I'll start off with a quote from the beloved Dr. Seuss, and it reads, "You have brains in your head, you have feet in your shoes, you can steer yourself any direction you choose." I like this quote because it really kind of shows the importance of how we think about moving our bodies and how critical that is to our survival. Our motor system is organized in a hierarchical structure. It looks kind of confusing and you kind of have to break it down into parts. It has multiple levels of control, which spans all the way from the spinal cord to subcortical structures up to the cerebral cortex. At the lowest level, action is represented with motor neurons and its associations with interneurons and the spinal cord. At the very top, areas like the premotor cortex and association areas of the cortex, and this is critical for planning an action that corresponds to an individual's goal. We take in information from our perceptual experiences, we integrate that with our past experiences, and all of that gets updated and executed with help of these association areas. In between these top and bottom layers sits the primary motor cortex, which we know helps to direct action and motor movement for specific parts of the body. We also have brainstem structures, which with the assistance of the cerebellum and the basal ganglia, help to translate goals into movement in a smooth and guided fashion. Okay, let's go over some quick anatomy of action in the brain. We have frontal eye fields, things like that helps with eye blinks, premotor cortex with helping to plan actions. We have our primary motor cortex and primary sensory cortex. There are a lot of interactions between our sensory and motor cortices, and that makes sense when we think about how we interact with our environment, taking in our world, and developing actions based on our senses. The posterior parietal cortex is an association area involved with action, and for instance, it's involved with things like spatial cognition. We also have the inferior parietal cortex, Broca's area for like the physical production of speech. The cerebellum, obviously, for helping to guide fine coordinated motor movements, and the basal ganglia, which is involved in movement and goal-oriented behaviors. So every time we plan and execute an action or a movement, these brain regions all act together to help achieve this goal. The basal ganglia we've talked about before in this class for its involvement in movement, action, and goal-oriented behaviors. We should remember that anatomically it involves a collection of regions, including the caudate nucleus and putamen. This is collectively referred to as the striatum, the globus pallidus, and some subthalamic nuclei, and the substantia nigra. Okay, so let's talk about some examples of when things go wrong in our action and movement system. Within the primary motor cortex, when there are lesions or brain damage, this can lead to something called hemiplegia, which is the loss of voluntary movements on the contralateral side of the body. Remember, the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body, and so it's contralateral. So say you have damage or a lesion to the right side of the motor cortex, this would often result in an inability to move the left side of the body. Mostly this is the result of some type of brain hemorrhage and a nearby cerebral artery. And this is a big manifestation or symptom of brain hemorrhage or stroke, and that's the ability or inability to move affected limbs. Apraxia is when you specifically have a loss of skilled action, so it's a condition that affects motor planning. With apraxia, patients often have problems performing purposeful and coordinated movements. There are two subtypes. The first is ideomotor apraxia. With ideomotor, that's IDEOMOTOR, apraxia, patients have a rough sense of what their desired action is, but they have problems executing it properly. They know exactly what they want to do, they just have trouble doing it. So I want to stand on one leg and reach across the table, I just can't actually perform that action. The other type is ideational apraxia, and this is the more severe subtype. Here, the action knowledge about the intent of an action is messed up or disrupted. With this, patients may not even comprehend what the appropriate use for a tool is or an object. For example, upon waking up in the morning, someone with ideational apraxia may pick up a hairbrush to try to brush his or her teeth. Just imagine how much this would disrupt your life if you were affected with apraxia. Imagine a college athlete who suffered a brain injury and developed apraxia, how their career would be over in an instant. Makes you appreciate how well our biological machinery kind of works behind the scenes.